students with the kind of the framework for how to go about doing that. And I'll kind of give us a high-level overview of what this actually means. So there's those three options, but I would love to know, and here you can follow menti.com, what option would you choose? And interestingly enough, I asked AI to help me create some of these images. And when I asked it to create an image around being confused or eek, I don't know yet, it gave me Joe Biden. So that's not my fault, it's AI's fault. So don't wrap me over the knuckles for that one. But I'd love to hear people's thoughts around what they think. You can vote, it's anonymous. Go to menti.com, put in the code. I see some people have used a combination of over and adaptation. 2 have done adaptation, that's great. You can click there and submit. Okay, ooh, 1 person doesn't know yet. That's good. I like being in that space of not knowing. It means you know what you don't know. I like that. Okay, so I've seen three people have used adaptation of guidelines or adaptation. I don't see anyone that has done the de novo approach yet. So from scratch, that's either a good thing. I like that. So we've got 6 votes so far. We can always circle back and have a look, but it's really great to see the kind of the spread of where people are at. You're happy, let me know in the chat if you've had any other approach that I haven't listed here in the quiz. So one of the questions I just want to talk about is, where do we start? And the Grade 39 guidance kind of gives us a starting point. And the most typical one that we like starting with and that we often refer to is selecting a guideline topic and then looking at questions first. So setting up your guideline questions and prioritization of questions first. So that's the PICO kind of centric approach, where you start with the PICO and you move down the guideline development process that way. But you also have the one on the left where you might actually have an existing guideline that you're looking at, a best bet guideline, if I can put it like that, and you start there. You select that guideline and then you prioritize questions within that guideline to adapt. Or on the far right, as you can see, where you use some kind of registry or platform that has an existing map of recommendations that you can pick and choose from. That's another approach one can take. And that's what grade guidance kind of puts forward as the approach of where one can start with guideline adaptation. So again, what has your experience been? Welcome, let me know in the chat, colleagues around. Have you started with using a guideline first, those that have done adaptation or adoption? Did you start with a question first? Did you start with a map of recommendations? I haven't done that one. I haven't started with a map yet. I've done a guideline-centric one and a question-centric one. So really keen to see people's views on that. See, there's some question prioritized first. Let me know in the chat too, and if there's people who want to put up their hands, then also really welcome to give input here. I see Prof. Gerhard is here. Welcome, Denise, others. Great to see everyone online. Again, you're welcome to join on menti.com. Use your phone and engage. It's really great to see. I see someone's used guidelines selected first. A couple. That's great. Would love to hear more about that in the chat. Maybe you can tell us a bit of what guideline did you use? Was it easy? Was it difficult? Let us know. Right, we're going to circle back to this. But I see most people have been using the questions being prioritized first. And I think that speaks to the majority of where the meta is now with regards to guideline adaptation. At least where most of the guidance has been pointing to. But we can definitely expand. So I asked AI, specifically Copilot, to summarize the grade 39 paper for me in 4 steps using an image. And this is the disaster that it came up with. Claire once told me that she used AI for trying to get some images for some of her work, and it also ended up in disaster. And I was like, surely no, I can do a better job. and I just couldn't. So I don't know if anyone else has tried to use AI to do work, but so far creating images with Copilot hasn't really worked. I'm not sure what it was trying to get right, but it looks like it thinks that graded development is some kind of life cycle of butterflies. So we shall see. So welcome those who are all coming from Nigeria. I see in the chat. Excellent. So here is my attempt at trying to summarize graded development in a single slide. This is meant to be animated, but the software doesn't do it using Mentimeter. So I'll quickly take people through the nuts and bolts of what graded development is. And so generally, one would start with a guideline PICO, and ideally, you'd want to identify a best fit guideline that matches your PICO. The next step then would really make an assessment of the underlying evidence within a particular matching recommendation within that guideline that you found. And this assessment is really to look at whether that underlying evidence, and hopefully it's from a systematic review that underpins that recommendation, gives you the necessary and appropriate information to populate the grade evidence to decision framework, which is really just a set of criteria and considerations that guideline panels look at to make a judgment around the evidence for a recommendation. And you'd want to assess the underlying systematic reviews from the guideline, hopefully if there's a good link, regarding benefits, regarding resources, and regarding qualitative evidence. However, the reality is that most guidelines aren't developed equally. Not all of them use grade. Not all of them even use systematic reviews to inform their evidence for recommendation. And so it might come down to the fact that you need to update the underlying evidence, or do a partial update of the systematic review they mentioned, or produce a new systematic review, which kind of takes you down the de novo route. So in a nutshell, graded development is this evidence to decision centric framework, and it aims to use existing guidelines, assess the underlying evidence to populate an evidence to decision framework to make that process simpler, as opposed to going down the de novo route. Here is a very busy slide around the Geller prototype development algorithm, and this is really much based on piece by piece of the graded development algorithm, except we've added a bit to it. What we've done during Geller and our experience with adapting guidelines in Malawi, South Africa, and Nigeria is added a bit to this that's specific to our needs across the three countries to ensure uniformity in applying graded development. And you can see we've added some detail around the what. So what are the things we're doing, how we should do it, and why we're doing it. And so for those who aren't familiar with graded development, this is the typical kind of algorithmic stepwise process, where eventually it ends up with populating an evidence to decision framework, where you start off by searching for potential guidelines that answer your question that you prioritized. And there you can use a scoping review of guidelines. You typically want to consider some of the things on the right-hand side that we mentioned. You then want to match the recommendation to potential source guideline for each prioritized PICO that you've got. So to do this, you essentially have to look at, does the guideline speak to the PICO that I've got? And there you can look at the recommendation level for per guideline, because they might have many recommendations in the guideline. You'd also want to look at, well, per matching recommendation, do they actually have a path to recommendation? Do they have a clear link to the underlying evidence that I can actually use? And then C, D, and E, you want to look at, is the guideline up to date? Is it likely to have missed important evidence? Is it credible? So in other words, can I trust it using Agree or whatever tool you want to use? And does it use grade methods, which is a big plus? Eventually, you kind of make the decision, well, do I have a credible guideline to use by looking at A versus to E? If you don't, it means you need to probably go down the de novo route of generating your own systematic review or scoping for existing reviews in 2B. If you do have a guideline, you need to go deeper into the underlying evidence, specifically around effectiveness evidence in populating those domains in ETD, qualitative evidence that some will talk about, and resource evidence. And eventually, depending on what you find there, you'll have to update the evidence, or you can just use it as is. All in all, to try and populate an evidence to decision framework to make it more efficient instead of going de novo route. So here is another quick screenshot around the 3 steps on the left, but also just to say that in doing this in Malawi, South Africa, Nigeria, we've had some lessons learned. And one of the main ones I just want to highlight is that using best bet guidelines, so guidelines like that are developed by the WHO that we know are credible, high quality, use grade, is a great first port of call. And I think it would be great also for those on the call who've done this in Malawi, South Africa, Nigeria, to reflect a bit around their experience around that. And there'll be some time for that in a moment. And also just to say that, grade has a learning curve to it, and it requires methodological guidance and expertise, and I think a good amount of capacity development and building, because it's not such a straightforward process. There's complexity on many levels. And I think I'm running out of time, so I'm actually going to pause there and thank Gela and just refer people to all the partners involved, but also to open up the floor. And here you can use Menti. You can type in a question if you like in the app, or even better, if you can put your questions or put up your hands in the chat, we can talk a little bit about what your experience has been in guideline adaptation. Have you had any challenges, comments, concerns, or successes? And I'd also want to draw on others who have done it in this space: Emmanuel, Rose, Elodie, colleagues who've gone through this process. And Prof. Harabat, I think you might have also been involved there with the South African guideline development space. So really keen to hear people's thoughts. Let's see if there's any questions or anything from the chat. What has your experiences been with guideline adaptation? Or does what I've said make any sense? Emmanuel, I'm wondering if there's any thoughts from your side from doing guideline adaptation in Nigeria and reflecting on what we've presented and some of the key learnings you've had.
Yes, thank you, Michael. Thank you for an excellent presentation. Yeah, so reflecting back, you recall that for Nigeria, we sort of went de novo for one of the PICO questions, and then went the adaptation route for the other question. And the reason why we went de novo was because, as you said, we didn't find any guideline with a matching recommendation. And for the second one, we found an existing, very up-to-date guideline by the WHO. And all we needed to do then was to fit in some contextual factors in the ETD, to help the guideline panel make the recommendations that are appropriate for the Nigerian, healthcare system. So, having these two perspectives, I assume for the panelists was quite a learning opportunity, for them. But I think the other thing as well is that the simpler the questions are, the better. The more complex they are, the more difficult it is to find a guideline, with a matching recommendation, and even to synthesize effectiveness or qualitative evidence may also be very difficult and complex if the questions themselves are complex as well. Thanks, Michael.
Yeah, thanks, Emmanuel. I think those are some real valuable reflections. And I see two questions that have come through, and some have been upvoted, so we'll go with those. So where and when does development save time and resources? I think that's a great question for all of us, and I'm wondering if there's any reflections from anyone who's done it. Some of the immediate reflections from my side is, in theory, it's meant to be more efficient, but I think it really depends on how intense you want to make it. You can, in theory, updating effectiveness evidence, qualitative evidence, and resource evidence is less intensive than doing it de novo, but it still requires time and resources if you want to do it properly. So I think that in theory, it makes sense that it's less intensive, but it's not always so in practice. And you need to kind of be practical regarding the context that you're in and what is available resources and what's feasible for your context. And I think that's part of the advantage of adapting recommendations, is it is bound within the context of what you're doing. So I think that's a great question. The second one is, love the presentation and Menti. I think we've kind of answered this. What is Gera's experience? Elodie, go ahead. Yeah, your thoughts.
Yeah, I just wanted to add to what you just said regarding when and where it can save resources and time. At least from the experience within Gela, I think we could also highlight the flexibility that is allowed within the development model and different parts of it, based on the conversation that we've had, also to be practical and pragmatic as to, okay, that we do need to provide the best evidence possible within also the constraint of what the guideline panel needed. So I think that's also an important element to take into account, is that the model is not fixed and you don't always have to do it one way. You have flexibility to adapt to the constraints you're facing.
Michael, you're muted.
Thanks, Emmanuel. It always happens. Hey, no, thanks, Elodie. Really appreciate that. Those thoughts and comments. I'm wondering, for those who have done who's used an existing guideline, I'm wondering if colleagues can reflect on some of the challenges they've had there. I know, Emmanuel, you said you've done de novo development, but I'm wondering if others from Malawi can speak about using existing guidelines, or those colleagues from South Africa what are some of the challenges that you experienced in doing guideline adaptation? Or approach? Do you think there's a better way of doing it? What have you been using? Looking for any hands or anything in the chat? Not yet. Okay, but I'm happy to move on. And Simon, I want to also give you some space to chat today. So I'm happy to move on to your side of the presentation, Simon, and hand over to you, and to take us through a bit of the qualitative side of guideline adaptation.
Thanks, Michael. I'm just going to try and share my screen.
Yeah.
Let's see what happens. Okay. Can you see the slides now?
Yep, that's it. All good.
Great. Well, hello, everyone, and it's very nice to see some old friends online, and very good to meet everybody else. As Michael mentioned, I'm going to be talking about the aspect of using qualitative evidence in development and adaptation of guidelines at country level. I'm not really sure how familiar those of us on the call are with what qualitative evidence is and what we might use it for in a guideline. I wonder if you've had experience with using qualitative evidence in a guideline, could you do a thumbs up or something like that in Teams, and then just give me a sense of how much time to spend on different slides? Just a couple of thumbs up there. All right. So I'll try and give a very brief overview at the beginning of this presentation of what qualitative evidence is and how it can be used in a guideline process. And then I'll move on to talk about how qualitative evidence can facilitate guideline adoption, adaptation at the national level, and the process for this. I'm not sure if it's just on my side, but there seems to be a bit of echo somewhere. No, maybe it's stopped now. Yes. So what is qualitative research? As many of you will be aware, qualitative evidence aims to describe the social world and to understand people's views and experiences of this. That can be patients, service providers, and citizens. And in many cases, we can use qualitative research to explain the social world by developing hypotheses, theories, or models. And all of this can be useful within guideline processes. And of course, you'll be familiar with some of the common methods that we use, interviews, focus groups, different kinds of observation and document analysis. And increasingly, qualitative studies are being synthesized into systematic reviews, which we sometimes call qualitative evidence syntheses. And the process for doing this is the same as one might use for other kinds of evidence, like studies of the effectiveness of interventions, and so on. So we would start off by systematically searching for relevant qualitative studies. When we found ones that are relevant to our question, we would assess their quality or the rigor of those studies, and then we would use a qualitative process of analysis to synthesize those data. So how might we use this kind of synthesized qualitative research in a guideline process? I think typically, and it was certainly the case in the past, that guideline panels base their recommendations predominantly on evidence of effectiveness. What are the benefits and harms of the intervention, drawing on evidence from systematic reviews of comparative or controlled studies typically. But of course, guideline panels and decision makers also are concerned about a whole range of other factors. How much will the intervention cost? What outcomes do patients and other stakeholders value? Is the intervention acceptable to those affected, patients, healthcare providers, and others? Can we implement it in our setting? And what might the impact be on equity, gender, and human rights issues? And for all of the areas that are in green here, qualitative research can often provide very useful information within a guideline process. One could also use other kinds of evidence for some of these questions, but qualitative research is potentially an important one. So we can use qualitative evidence to help understand the underlying problem that a guideline might be attempting to address and some of the options for addressing it. And as I mentioned, we can also use it to look at how people value different outcomes and issues around equity, acceptability, and feasibility. But importantly, and this is very relevant for the national level, is that qualitative evidence can help us to develop implementation considerations for the guideline that are tailored to, for instance, a national or subnational setting, particularly if we're drawing on qualitative evidence from that setting or similar settings. So I thought I'd give a very quick example of using qualitative evidence in an evidence to decision framework for a guideline. This is not specifically from an adaptation or adallotment process. I'll come to that a bit later, but just to give you a sense of how that works in practice. So I'm going to use an example from a WHO guideline This was a guideline focusing on digital interventions for health system strengthening, and particularly digital interventions that can be delivered via mobile phones. And it included interventions like telemedicine, targeted client communication, health worker training, clinical decision support, and so on. So the one I want to go through is the question around targeted client communication. Should the WHO recommend this for use in most settings? And so what is targeted client communication? It's where we give information to patients or the public by mobile phone. It could include health promotion messages, reminders about health services, or diagnostic test results. And it's targeted in the sense that you're sending that information not to the whole population, but to a group who you know is, for example, at risk or has a particular health condition. So in the guideline process, one of the questions that was looked at is what effect does targeted client communication via mobile phone have on people's use of healthcare, their health status, and health behavior? And for that, we used a Cochrane review of effectiveness. And the evidence from that review showed mixed effects. There were probably some benefits for some outcomes, but it may make little or no difference to others. What does it cost? In this case, there was no systematic review of cost information or cost effectiveness information, but there was a discussion within the panel and the guideline development group, and they agreed that there were large startup costs for these kinds of targeted client communication programs and also large recurring costs predominantly related to the use of text messaging. So is it acceptable to send people these kinds of messages? So here is where we started to draw on the qualitative body of evidence. We undertook a qualitative evidence synthesis, which showed that many positive to these services. This was a moderate confidence finding. And the reason for this was that they felt that it provided them with support and reassurance in relation to their health issue, and it made them feel like someone was interested in their situation and cared about them. However, there was a caveat to that. The study showed that clients who are dealing with health conditions that are often stigmatized or very personal, areas like HIV and AIDS, family planning, abortion care, worry that their confidential information might be disclosed through these messages. And this was a high confidence finding. So is it feasible to implement targeted client communication? Again, we drew on the same qualitative evidence synthesis, which showed, not surprisingly, problems in many settings with things like network connectivity, access to electricity. This is an issue in South Africa in the past, of course, system integration and device usability. And what's the impact of these interventions on equity? Are certain groups of people likely to be systematically disadvantaged in relation to these services? The same qualitative evidence synthesis provided some valuable information on this, showing that services might be particularly helpful to people with caring or work responsibilities, people who live far away from health services and find it difficult to be there in person, and people who have few resources and would find the travel costs to be onerous. And access to these services, on the other hand, might be particularly difficult for people with poor access to networks or electricity, as I mentioned, people with stigmatized health conditions who have concerns about confidentiality, and of course, people who speak minority languages or who have low health or digital literacy skills and may find it difficult to interpret information that's being sent to them. And of course, people with poor access to mobile phones, which in some places particularly includes younger adults, young people who are not yet adults, but also in some cases, women and older people. So the panel assessed all of this evidence that I've summarized very briefly to make a recommendation. And in the end, they made a conditional recommendation. They recommended targeted client communication under the condition that potential concerns about sensitive content and data confidentiality can be addressed. So you can see here that the qualitative evidence was quite important in shaping this recommendation. And they were able to use some of this evidence to develop implementation considerations at the global level. For example, implementers should ensure that the content, format, and delivery of information meets the needs of different target groups. So that was a very brief example of how we might use qualitative evidence in a guideline process in general. I might just stop there to see if there are any questions before I move on to the part dealing with dealing with ad allotment. Does anyone want to make a comment or ask a question? You can either unmute or put it in the chat.
Not seeing anything in the chat yet, Simon, but I see Amanda's made a useful comment around some nuances in development. We can have a look at it a bit later.
Great. Okay, I'll continue. So how can we make better use of this kind of synthesized qualitative evidence in national adaptations of global guidelines? So as I mentioned earlier, we can use qualitative evidence for many sort of domains within the decision-making process for a guideline, and you can see those domains on the left of the screen. And one example of how the adaptation process might be informed by qualitative evidence is around acceptability and feasibility of interventions. So you may have, for instance, qualitative global evidence or global qualitative evidence that suggests that some stakeholders have a strong concern about the acceptability of the intervention, and you know that these stakeholders are particularly important or a large group in your setting. So for instance, if this intervention
Simon, I think you're accidentally muted. Sorry for interrupting. You accidentally muted yourself.
How strange. Okay, where was I? So what I was trying to say was that you may have evidence from a global qualitative evidence synthesis that indicates that some stakeholders in relation to your guideline question have strong concerns about the acceptability of an intervention. And if these stakeholders are also important in your national or subnational setting, this would obviously be something to take into account in the guideline adaptation process. The qualitative evidence may also indicate that an intervention is less feasible within health systems models similar to your setting. And this, again, would be valuable information as you are attempting to adapt a global guideline for your setting. So I'm not going to go into all these different aspects here, but you can certainly look at them and recirculate the slides. So as part of the GELA project, we've developed a decision tree for using qualitative evidence in an ad allotment process. You don't be able to read this. It's quite a sort of long tree, as you can see, but it builds on the decision tree that McCaul outlined earlier for the ad allotment process and is based on several, I suppose, what you could call principles. So firstly, the decision tree tries to encourage users to make best use of any synthesized qualitative evidence available from a global or other kind of guideline that's being adapted or adopted for the national level. So that is the first step. Can we make use of any existing synthesized qualitative evidence? Then we may need to conduct new syntheses at national, regional, global level of qualitative evidence to address key gaps that are, if any, that are identified in the qualitative evidence from the global level. For example, we may need to update the global qualitative evidence if it's coming from a guideline that was done several years ago, and this is a field where things are changing rapidly. I think Amanda's point in the chat speaks to that, and that's a judgment that needs to be made in relation to the intervention that you're looking at. We might want to conduct new syntheses of qualitative evidence to gather information from the implementation setting that we're concerned with, or to gather evidence on a particular domain that was not well covered by the global evidence, for example, acceptability or equity implications. We then need to consider how best to bring together any global and local qualitative evidence within the guideline process. And one of the things I think we learned during the Geller project is that that's not a straightforward thing to do, because well, I think for lots of reasons, you're sort of talking about slightly different bodies of evidence. You may have a mini review of studies from your own country and a global review, and you have to kind of weight the findings from those different reviews, as well as make judgments about how much confidence to put in any kind of merged findings that you develop. And finally, we need to make sure that the rigor of any qualitative evidence used is examined, and that an appropriate approach is used to assess how much confidence we can place in this evidence. And that's really important for the judgments that we're making within the guideline allotment process. So just to sum up, a national group that's involved in adapting a global guideline can consider the available qualitative evidence and decide, for instance, whether on the basis of that, the strength of the global recommendation needs to be changed. You may decide that because of acceptability issues in your setting, you're moving from a strong recommendation to a conditional recommendation. It may inform whether the intervention should be recommended for a narrower group of people nationally, for example, for particular age groups, or whether the intervention should only be implemented in specific settings. So to finish, I think what I've tried to sort of show here is that qualitative research can help to bring a range of voices into decision-making for national adaptation. It can offer a good source of information about what matters to different groups of people and can be particularly valuable in representing marginalized voices that might not be part of guideline development groups. But of course, these types of evidence are not a substitute for participation in decision making. We still need to try and ensure that citizens and other affected groups have a place around the table during guideline development. So back to you, Michael. I'm happy to take any questions or comments that people want to make from their own experience of using qualitative evidence in this allotment process.
Thanks, Simon. And colleagues, yeah, welcome to just give us your thoughts in the chat. You're welcome to also unmute, put up your hand. You're really welcome to, as we reflect on Simon's presentation. I mean, Simon, I've got one quick question for you, and that is from my own understanding. Is you spoke about kind of global qualitative evidence and bringing that down, making it applicable to local. And do you have any advice for committees who are looking at global evidence or studies that are outside of their national borders and the transferability of that evidence to the local setting? How do they handle that kind of dilemma that you kind of touched on briefly?
Yeah, that's a really interesting question. And within the Geller project, we used an approach called the transfer approach. That was particularly when we were developing new qualitative evidence syntheses, but you could also use it to help you better understand transferability for existing global qualitative evidence syntheses. And the transfer approach it's not rocket science. It's about getting a group of stakeholders together in your setting to talk about what might, in their view, affect the transferability of findings from other settings to their settings. And we find the kinds of information that we get from those discussions with, for instance, clinicians, patients, and others, health service planners, to be really useful in interpreting or making those transferability judgments. And where you are doing a new qualitative evidence synthesis for a guideline, a de novo synthesis, you can use that information to inform your judgments about the relevance of findings as part of assessing confidence in the findings. So it has another useful aspect. Some others in the call were involved in some of those meetings and may want to comment on that. I know Emmanuel, Elodie, if you wanted to say a little bit more about the transfer processes.
Yes, Simon. Thank you very much. And again, yes, I recall that we used the a transfer meeting for two actually. One for the question around hand hygiene, and the other one the question around enteral feeding. And I know that there are a few people here on the call from the Nigeria, either the steering group or the guideline panel, that participated in either of those meetings. And I mean, the meetings brought some really very great insight into how some of those interventions we're looking at may work in the Nigerian healthcare setting, whether at the tertiary or at the secondary care level. And I think that for the most part, some of those insights really helped the guideline panel to come to some recommendation that was truly contextual for the Nigerian healthcare system. And in fact, in one of them, we ended up with so whereas in the the question around enteral feeding, whilst as I recall, the WHO recommendation was a strong recommendation, but when all of some of these things were considered, the panel decided that it should be conditional based on some of the contextual factors and some of the transfer factors that were considered in the meeting prior to the guideline panel's final meeting. So I think it's quite a great process to sort of not really to supplement, but to inform the recommendations that usually will be guided by the qualitative evidence that's available. Over.
Thanks, Emmanuel. And it actually reminded me when you were talking about the enteral feeding guidelines that for me, one of the really striking findings from the qualitative evidence synthesis that was done to inform those questions was, and something which is obvious when you hear it, but it didn't occur to me beforehand, was that parents of young babies and children who are in pediatric intensive care or high care and who are needing enteral feeding, they in the qualitative evidence showed that they saw the insertion of these tubes and so on as a sign that their babies were dying, not as something that was helping, but like this was the end. And so it was very important information for how, in terms of how one might implement these interventions and the kinds of information that need to be shared and needs to be shared with parents and caregivers. So that was interesting aside about the findings from that review. Were there any other comments or questions or experience that people would like to share?
I see, Simon, you've shared the link to the transfer approach in the chat. So I just want to encourage people to have a look at that, especially as they're looking to using perhaps global evidence, qualitative evidence for local guidance or adapting work. So thanks for sharing that. Simon, I'm thinking that now might be a good time to transfer to talking a bit about next steps for the community of practice, if that's okay with you. Yeah, I'm not seeing any questions coming through, but Simon, thank you very much for that presentation, really to the point and striking the message home. So we've got the last couple of minutes or so as we kind of head up to the hour. And I just want to encourage colleagues to climb onto menti.com again, put in the code that you see there on top. I think Amanda can maybe put the code in the chat for us. So climb onto menti.com. And what we really want to just gather now is just some of your thoughts from everyone on the call around what might be some of the next topics that you want to deal with or engage with in these teams get-togethers and calls in November and then in February again for 2025. So there's, I guess, two ways to do it. So climb onto Menti and give me a thumbs up if you're on it. I see some thumbs up coming up already. And we're going to do a round of voting, so a bit of consensus building. So climb onto Menti, and you're going to put forward at least three topics that you think that of interest to you, that you want to hear more about regarding guideline development or evidence synthesis or a process within the guideline realm that we can tackle as a group and discuss in our next sessions. So go to menti.com, add the code in, and you'll get three options three opportunities to add your suggestions, and then we're going to be able to vote on those suggestions. So you can submit your ideas for the next topic, and then we get to vote and see if this all works, and hopefully it does work. So let me know, whip out your phone, let me know what topics you've got in mind. You put in a topic and then you click submit, and it'll ask you for another suggestion. If you don't have another one, then let me know. So we've got one already that's come through. That's great. And another one. Excellent. And I think we should also, once we've got all the votes, all the topics, using economic evidence to inform guideline recommendations. Okay, very good. How do we prioritize guideline topics, questions, and outcomes? Yes. That is also definitely one. Finding and generating resources, economic data for the evidence to decision. Okay, that's very similar to the economic one. How do we select or prioritize outcomes for guidelines? Effective dissemination of guidelines. That's also very exciting. So you're welcome to use the app, but also put in the chat if you've got any suggestions. When and how to update guideline recommendations. I can't be biased. I like that one. That and the prioritizing guideline question. But I think we can give a couple of more minutes just to get more responses, some suggestions. Also happy to have a look in the chat. I don't see anything new coming through there. Feel free to also just unmute, let us know what you're thinking. And I think we can start voting. Also, if you want to put in the topic, put it in the chat. So here's your chance to vote. So you can have a look at the app, try and vote and see which one. I think you can choose 3 votes. So your top 3. So we also have dissemination of guidelines, keeping stakeholders on board. And then you can select your 3 votes and then you submit. You can press submit. So hopefully everyone can see that. I'm going to start showing results. I think 3 people have voted. Okay, here we go. Oops. So we've got so far our most popular ones, and not entirely blinded, but welcome more to vote. We've got resources, economic considerations, and guidelines so far, and when and how to update guideline recommendations. Okay. Other suggestions, let me know, and you're welcome to keep voting while we close off the session. We can always have a look at this later and send out perhaps another survey to get a bit more of a broader representation across the community of practice. But this is at least, I think, a first pass kind of litmus test of where people are at. So that's really great. A very quick request is to please fill in the 5-minute survey. Do it right now while you've got a chance and you're online. Amada's placed it in the chat. We want to get some feedback from you around today's session, what we can do better. Did you have any aha moments? And what did you really enjoy? So we really want to know those things. Let me know in the chat as well if you've had an aha moment today and what you really enjoyed. So thanks so much. I see there's a question from Tamara. We've had requests to open this COP up to others. What do people think to include interested people outside of our team, Gela? Yeah, thanks, Tamara. I'm wondering if people can let us know in the chat what they think. Others, let us know your thoughts to opening it up to a wider group of people within our networks. We'd love to hear your thoughts, as I think we can eventually evolve this community practice into a larger group building capacity. We could perhaps add it to the survey tomorrow, yeah, if people are a bit busy at the moment. All right, so from my side, colleagues, we're going to engage a bit further, perhaps on WhatsApp around opening it up further tomorrow, or on the survey. I think there's lots of ways we can do that. I would like to say a very big thank you to everyone for joining, especially on a Friday afternoon. Enjoy your weekend. Thank you to Simon, team, and Gela for just being present, being here, and supporting. And again, mostly thank you to everyone else who's joined on the call. Really appreciate your time. I hope it's been fruitful. I, for one, have definitely enjoyed the session with everyone. Thanks all, and have a wonderful afternoon and weekend. All the best. Videos on if you can. Wave and say hi. Thanks for all the
thanks, Michael. Thanks, Simon. Thanks, everyone.
Cheers all. Cheers, Emmanuel.
Thanks,
Bye.
everyone.
All.
Thanks.
Thanks, Michael. That was awesome. Thanks.
It was
Thanks.
great seeing you
Thanks,
guys.
Bye.
Yeah.
Thank you, Michael. Profound. Thank you.
It's an absolute pleasure, Dixon. Emmy, good to see you. Cheers and hi, Evo. Great to see you. Thanks for joining, Mary.
Thank you, Simon. Thank you, McCaul.
It's a pleasure. Have a wonderful weekend and enjoy, and thanks again. Queeneth, Valentine, great to see you. Thanks for joining.
Yeah, thank you for the presentation.
It's an absolute pleasure. Hope to see you again soon. Cheers. Thanks, Emmanuel. Thanks, Amanda. Enjoy the weekend.
Thanks, Michael.
Thanks, Emmanuel. Good to see you. Thanks, Michael. Good session.
Thanks, Amanda. Bye-bye.
Cheers, Amanda.
Have a nice weekend.
Take care. You too.
All right. Bye-bye. Bye.
Amanda, is our survey anonymous? Do you know?
It's anonymous, yes. I'm trying to add that question now about the interested people.